what is the definition of allergic rhinitis? It is an IgE-mediated immunologic response of nasal mucosa to airborne allergen and characterized by watery nasal discharge, nasal obstruction, sneezing, and itchy nose. Next, moving on to the pathogenesis, when patient inhale allergen, their body will produce specific IgE antibody, which fix to the mast cells at the Fc end. On subsequent exposure, the antigen will bind to the IgE antibody at the Fab end. This reaction will produce degranulation of mast cells, which release several chemical mediators, such as histamine, which lead to the inflammatory reactions such as vasodilation, mucosal edema, excessive secretion, and smooth muscle contractions, in which this reaction will lead to the allergic rhinitis symptoms.
The clinical presentation to allergic rhinitis, the symptoms is usually 2 or more and lasting more than 1 hour on most days. The symptoms can include runny nose, sneezing, watery eyes, stuffy nose, and other clinical presentation. The patient may have history of asthma, eczema, as well as a positive family history. For physical examination, look for allergic salute sign on the nose, allergic shyness under the eyes, and on anterior rhinoscopy, look for pale and hypertrophied inferior nasal turbinate, and peripherally, look for any reaction such as eczema.
If patient has been suspected to have allergic rhinitis, allergic testing can be done to identify the specific allergens that trigger the symptoms. The 2 common types of allergic tests are skin prick test and blood test. In a skin prick test, small amounts of potential allergens are applied to your skin and any resulting wound reaction is observed. As for the blood test, serum-specific Ig can be done to measure the level of antibodies in your blood in response to the particular allergen. The management of allergic rhinitis involves a combination of allergen avoidance, medication, and in some cases, immunotherapy. In allergen avoidance, the patient has to identify and avoid the triggers. They have to determine the specific allergens that trigger the symptoms and take steps to minimize the exposure to them. For example, if a patient is allergic to pollen, they have to stay indoors during the high pollen counts, or use air purifiers with HEPA filters. As for the pharmacotherapy, intranasal steroid spray can be given to patient as a prescribed medication in order to reduce the inflammation in the nasal passages and provide a long-term relief of symptoms. And antihistamines can be given over the counter or as prescribed antihistamines to relieve the itching, sneezing, and also runny nose symptoms. They are available in oral, nasal spray, and also eye drop forms. As for the immunotherapy, allergy shots can be given. If the symptoms are severe and not well controlled with other treatments, the healthcare provider may recommend allergy immunotherapy. It involves regular injections with small amounts of allergen to help your body to build tolerance over the time. The surgery is typically reserved for cases where conservative measures and medications have failed to adequately manage symptoms or when there are specific structural abnormalities contributing to the condition. The turbinates are structures inside the nose that help filter, warm, and moisten the air we breathe in. In some cases of allergic rhinitis, the turbinates may become enlarged, leading to persistent nasal congestion. Turbinate reduction surgery aims to reduce the size of the turbinates, improving airflow and relieving the symptoms. It's important to note that surgery is typically considered after other treatment options have been exhausted and when symptoms significantly impact a person's quality of life. The decision to undergo surgery should be made in consultation with an experienced ENT specialist who can evaluate your specific condition and determine the most appropriate course of action. They will consider factors such as severity of the symptoms, presence of structural abnormalities, and your overall health before recommending any surgical intervention.